Hello, my name is Elizabeth Renteria, and today I'll be performing the skills video for IV fluid and medication administration. I'm in my appropriate Nightingale uniform with my Nightingale badge. Our patient for today will be receiving IV fluids and a piggyback for amoxicillin. Both of my primary and secondary tubing sets are macro drip sets that deliver 15 drops per milliliter. So our healthcare provider's orders for fluid is 150 milliliters per hour. And then our piggyback for amoxicillin is 250 milligrams, 100 mLs per 15 minutes. So with our calculations for our fluid, we are going to be giving 38 drops per minute. And for our amoxicillin piggyback, we're doing 100 drops per minute. The first thing that I'm going to do is verify my healthcare provider's orders in the MAR. I'm going to verify my patient using 2 patient identifiers, and then I'm going to go over the 6 rights of medication administration, which is the right patient, right drug, right dose, right time, right route, and right documentation. And then I'll verify my patient's allergies and their medical record, and then also verbally with my patient. The first thing that I'm going to do is perform hand hygiene, and then I'm going to don gloves, and then I'll gather the supplies that I'll be needing. So I have my primary and secondary tubing set. I have my patient's IV access with the lure lock at the end. I have 3 alcohol swab pads. I have my fluid, and then I have my bag for amoxicillin, and then I have my hook for my fluid, and then my hook for my piggyback for amoxicillin. So I'm going to open up my primary tubing set and then go over the different parts of the tubing. So this part here is called a spike end. It's what we use to spike our bags, such as our fluid and then our amoxicillin. And then this part here is called the drip chamber. The drip chamber prevents any air from getting into our line. It also helps us visualize our flow rate, and then we want to make sure that it's at least halfway filled by squeezing it before we prime our line. And then we have next this part here that's called a roller clamp. This helps us adjust the rate of our flow. So if it's rolled all the way down, our line is closed, and we can slowly open it by rolling the clamp up, and then close it by rolling the clamp down. Next, we have our Y site. This port here helps us deliver or administer additional fluids or medications with only using a single IV line. And then this end here is called the adapter end. The adapter end connects to the end of our patient's lure lock, which helps deliver the fluids into the patient's IV. The fluids or medications into the patient's IV. The first thing that I'm going to do is spike and prime my fluid. So then when removing the cap from the spike, you want to make sure you're maintaining sterility throughout the entire process. So I am going to remove the end cap from my spike, and then remove the end cap for my fluid. And then I'm going to spike the bag. I'm going to want to make sure that I'm hanging my fluid at least 30 inches above my patient's IV site. And then I'm going to gently squeeze the drip chamber to fill it at least halfway with fluid. And then I'm going to remove the end cap from the adapter end. And then I'm going to slowly pry my tubing by slowly rolling up on the roller clamp and ensure that there are no air bubbles. Okay, there are no air bubbles, so now I am going to roll down on the roller clamp, and then I am going to attach this to the lure lock. So I'm going to remove the end cap from the lure lock, and then I'm going to grab an alcohol pad to clean the end of the lure lock. Cleaning the end of the lure lock and letting that air dry for 1 minute. Then I'm going to attach the end from the adapter end. And then now I'm going to adjust my flow rate of fluid. So we want 38 drops per minute. So I am going to slowly roll up the roller clamp and then time the drops for 1 full minute. And we want to make sure that we are at 38 drops per minute. We can roll up on the roller clamp to make the drops come out faster, or if they're coming out too fast, we'll want to roll down on the roller clamp. Okay, we've counted for 1 full minute and we are at 38 drops per minute. In the real world, I would let this line run, but for this video's purposes, I'm going to roll down on the roller clamp to close our line. The next thing that I'm going to want to do is spike and prime the tubing for my amoxicillin. Before I do that, I'm going to verify my healthcare provider's orders in the MAR, and then I'm also going to go over the 6 rights of medication administration, which is the right patient, right drug, right dose, right time, right route, and right documentation. And then I'm going to want to verify my patient's allergies again, both in the electronic medical record and then verbally with my patient. I'm going to open up my secondary tubing set, which is going to be for my amoxicillin. And I am going to want to make sure that the roller clamp is rolled down so that our line is closed. I am going to also want to remove the spike end and then this end cap. And then we're going to spike our bag. We are, again, going to want to make sure that our bag is hanging at least 30 inches above the IV site and that we're hanging our piggyback above our fluid. And then we are going to want to fill the drip chamber. And then we're going to want to prime our line. So removing the end cap from the adapter end. And then slowly rolling up on the roller clamp to get rid of any air bubbles. Okay, now we are going to roll down on the roller clamp, and then we are going to want to locate the Y site on our tubing. And then we are going to want to clean the Y site port with an alcohol pad. We're going to dispose of that and let it air dry for 1 minute. And then we are going to attach our tubing to the Y site. And now we're going to want to adjust our flow rate. So for our amoxicillin, we want to make sure that we are administering 100 drops per minute. So we're going to slowly roll up on our roller clamp and then count for 1 minute. Okay, so we are at 100 drops per minute for our piggyback for amoxicillin. Again, in the real world, I would let this run, but for this video's purposes, I'm going to close the line. I am going to want to discard of my trash, and then I'm going to want to check the IV site for any signs of infiltration, such as redness, swelling, any blanching of the skin or cold to touch. And then I'm going to remove my gloves, perform hand hygiene, and then document the procedure in the patient's chart.